I'm obsessing. Are you obsessing? I'm obsessing. I'm obsessing. Well, the person has a fever and a headache and a headache and a fever and a fever and a headache and a headache and a fever. Headache and a fever and a fever and a headache and a headache and a fever and a fever and a headache. Well, if I want you to know it's meningitis, I'll tell you that there's a stiff neck and photophobia, Kernig's and Brzezinski's sign. And if I want you to know it's encephalitis, I'll tell you that there's the acute onset of fever and confusion, acute febrile confusion, and then it is CT, PCR, and acyclovir. Now, if I want you to know it's a brain abscess, I will tell you that there's focal neurological findings. My arm is weak, my leg is weak, or I present with a seizure. Now, this is a short section because you're here to answer the most likely diagnosis. What's the best initial test? What's the most accurate test? What's the best initial therapy? What would you like to do next in the management of this patient? So the CT, the MRI of the brain, shows a ring or contrast enhancing lesion. A ring or contrast enhancing, a ring or contrast enhancing. It shows a ring or contrast enhancing lesion. What is the most accurate test? The most accurate test is a brain biopsy. But I need a brain biopsy like I need a hole in the head. Ba-dum, bum, ba, So the more important question is this. What is the next best step in the management of this patient? What is the next best step in the management of this patient? A person comes in with fever and a headache, focal neurologic findings. Maybe they've had a seizure. And you find a ring or contrast enhancing lesion. What is the next best step in the management of this patient? It comes down to if the person is HIV positive or HIV negative. Now, if I ask the average medical student, what's in a ring enhancing lesion, I get told it's toxoplasmosis or lymphoma. And that is true if you have AIDS. In HIV, 90% is going to be toxoplasmosis or lymphoma. If you have less than 100 T cells, less than 50 T cells, toxoplasmosis or lymphoma. If you have really low T cells. That's what it is if you have really low T cells and you have HIV. But if you're HIV negative, it's not just toxo or lymphoma, it's cancer or infection. If you're HIV negative, it could be any cancer versus almost any infection, staph, strep, gram-negatives, anaerobes, astrocytoma, glioblastoma multiforme, ependymoma. If it's HIV positive, then the answer is that you give treatment for toxoplasmosis, pyrimethamine and sulfa. Which sulfa? Used only in this one thing, no other disease, not sulfamethoxazole, not sulfasalazine, sulfadiazine. Sulfadiazine, not anything else. Sulfamethoxazole is for urinary tract infections and for pneumocystis. Sulfasalazine is for inflammatory bowel, but sulfadiazine. Pyrimethamine and sulfadiazine. You treat them and you repeat the CT scan in 2 weeks or so. You retreat them, repeat the CT, the MRI in 1 or 2 weeks, 2 weeks, 3 weeks. And if it is smaller, it means it's toxoplasmosis. If it responds to therapy. Now, the response to specific therapy is generally a crappy way to make a diagnosis because it's usually inexact. But this is one of the few times that a response to specific therapy is a way of making a diagnosis. What else besides toxoplasmosis gets better with pyrimethamine and sulfadiazine? Malaria. Nothing else really. So it's highly unlikely that you're going to have a plasmodioma in your brain, a falciparoma. So if you get better with pyrimethamine and sulfadiazine, it is toxoplasmosis. You treat and repeat it. Now, if it's the same, if it didn't respond You have to biopsy the patient because you don't know what's inside there. Because the other 10% of it, 1% of it can be fungal. 1% of it might be tuberculosis. 1% of it might be aspergillosis. 1% of it might be nocardia. 1% of it might be something else. 1% of it can be A, B, and C. You better biopsy. That's the only way you're going to know. So, I have a fever and a headache and a headache and a fever. Maybe I had a seizure, focal neurologic findings. The scan shows a ring or contrast-enhancing lesion. Ring and contrast-enhancing lesions are cancers and infections. Now in HIV, the cancer, the infection, 90% of the time is either toxoplasmosis or lymphoma. So you give specific therapy and see if it responds. Why do I have to biopsy if it doesn't respond? You might say, hey, Conrad, it's lymphoma. Well, first of all, you don't know that for sure. Second of all, even if you know it's lymphoma, what kind of lymphoma? Is it Hodgkin's, non-Hodgkin's? If it's not Hodgkin's, well, Conrad, most of the lymphomas in HIV are non-Hodgkin's. Not good enough. There's 14 separate histologic classifications of non-Hodgkin's lymphoma. 14. And you have to know which one it is before you start treating. So you have to biopsy it. Alternate high-functioning question, what if you're allergic to sulfadiazine? The alternative to sulfadiazine is clindamycin. Pyrimethamine and clindamycin. Now, next question. What if you're a person who's HIV negative? HIV negative people have to be biopsied up front. You don't know what's in there. Now, this is very hard for people to accept. They want to say, just give them antibiotics. But it's not correct. You have to know what's in there. You can't just say, I'm going to treat this person with antibiotics, because you don't know, even if it's an infection or if it's cancer. You can say, well, I want to give vancomycin and ceftriaxone. I want to give vancomycin and ceftriaxone and metronidazole. I'm going to give metronidazole for anaerobes. I'm going to give ceftriaxone or quinolones for gram negatives. I'm going to give vancomycins for staph and MRSA. And you might say that's pretty awesome empiric coverage, and that'll kill everything. And it's not true. If it's tuberculosis, it won't cover that, will it? If it's a fungus, it won't cover that. And if it's glioblastoma, it sure won't cover that. I don't understand. I've been treating this glioblastoma with antibiotics for 4 weeks, and it's still not better. Or how about this? Oh, it's cancer. What'd you do? Well, I've been radiating and giving them chemotherapy. What happened? Well, I don't know. The MRSA is still not better. Yeah, well, I bet it's got a suntan from all that radiation you've been giving. Get a biopsy. It's very hard for people because they don't know, because they think everything about empiric therapy. So much of infectious disease is just empiric therapy. You don't get a specific bacteria and sinusitis and otitis. You just give them amoxicillin clavulanic acid. You don't get a specific diagnosis in pneumonia 3/4 of the time. You just give them ceftriaxone and azithromycin. But it's not the fact. You have to biopsy. 1, you don't know whether it's cancer or infection. 2, what kind of cancer you don't know. 3, infections. 1/3 of the time, it can be staphylococcus. 2/3 of the time, it's an anaerobe spreading in there. 1/3 of the time, it's streptococcus. And 1/3 of the time, it's a gram-negative bacillus, E. coli, Klebsiella, Enterobacter, Citrobacter, Morganella, Pseudomonas, Serratia, E. coli, Enterobacter, Citrobacter, Morganella, Pseudomonas, and Serratia. 1/3 staph, 1/3 strep, 1/3 gram-negatives, and 2/3 anaerobes. You don't even know what's there. What do you think? This is so complicated, I got 5/3. How do we get to 5/3? Because it's mixed polymicrobial, which makes the need for a brain biopsy even more important. But Conrad, you said we can give vanc and ceftriaxone and metronidazole. Oh, you can give vancomycin and penicillin. And metronidazole, yeah, you can do that. You can switch this out for linezolid or daptomycin, but you still won't cover it. I was once called to see a woman. Is like, I was in a hospital, and somebody who'd been in a step 2 class said, "Dr. Fisher, I heard you're working in our hospital now." "Yeah, why are you whispering?" "Well, because the other infectious disease doctor saw the patient, and I'm not sure I should be calling you, but I'm a second-year OBGYN resident, and I had you in a step 2 class a couple of years ago." "Okay, I won't tell anybody." "Well, I've got a lady here who had a seizure, and she came to OBGYN. She came to labor and delivery at 30 weeks of pregnancy, and we thought she had eclampsia, so we delivered the baby." "Uh-huh. Except it wasn't eclampsia. She, in fact, has a brain lesion that would ring enhancement." Well, like, look, you got a brain enhancing brain lesion, you need to get a brain biopsy. "Well, that's what I read in your step 2 class. That's what I heard. But the other doctor says to give her 6 weeks of empiric antibiotics." "Oh, 6 weeks of empiric antibiotics? How do you know it's there?" "I don't know, but I don't understand anything. I'm a gynecologist, but this is what you told me to do." "Listen, the person needs to get a brain biopsy." "I know that, but nobody's coming in on Saturday. Will you come over and write that note?" Okay. So I go in and I write the note that says they need a brain biopsy. The family took it very serious. The person had been on 3 days of this empiric coverage, and they transferred her to another hospital because everybody else like, "You can't get a brain biopsy." And it turned out to be neurocysticercosis. And what was very strange about it is that is a worm that only happens from pork and beef, especially pork, and the woman was a vegetarian. But you know what? You can't tell who's preparing your vegetarian food. Are they eating meat? She had eaten contaminated vegetables from somebody who ate meat that prepared her food. And she had the thing cut out. So what this proves to you is that the woman who was admitted with the seizure turned out to have a brain lesion. The baby is delivered prematurely because it wasn't preeclampsia, it was a seizure from a brain lesion. And then they would have compounded it by giving her 6 weeks of empiric uselessness. You don't have to agree with what I tell you, but it's right either way. You don't have to agree. It's just the way it is. HIV positive people, treat and repeat the scan. HIV negative people, get a biopsy. Any one of these is good empiric therapy, but a biopsy is gooder.